Welcome back. The Food and Drug Administration now says vaccine manufacturers should update their COVID-19 booster shots to target the most recent Omicron subvariants that are gaining ground here in the U.S. Dr. Jeff Pothof joins us from UW Health live for a look at what this means for the future of the pandemic response. So Dr. Pothof, thanks for your time today. Let's start with that latest recommendation from the FDA. Are we going to see these vaccine manufacturers update their shots to target these new variants? And what does that mean for people who are already fully vaccinated?
Yeah, I think you will see these manufacturers try to target these most recent Omicron variants. Right now, that would be BA.5 and BA.4. And if we're able to do that while still maintaining protection against whatever that next variant might be, we might see better protection against any symptoms at all. Our current vaccines, if you're vaccinated, boosted, do really do a nice job of protecting against severe disease. But we could get back to that day where if you're vaccinated, you could have 80, 90+% chance of having no symptoms at all if we can match that vaccine with those variants that are out there in the fall.
And parallel to this, BioNTech and Pfizer say they'll start testing a universal vaccine for coronavirus. Now, how would those shots go beyond the current approach?
So right now, our current approach really has those vaccines producing what we call neutralizing antibodies. So a specific type of cell that your body makes that can kind of attack the virus. What these universal vaccines would do is also recruit, T cells and other cells in our immune system that might make these vaccines a little bit more effective, even as we start to see different variants come across. So a little bit different structure to the vaccine than what we've currently seen, and that would be a welcome advance too in our fight against COVID-19.
Okay, the vaccine conversation, an ever evolving one. While we have you here, I do want to ask you about monkeypox. We know at least one case has been confirmed in Wisconsin. How vigilant should we be about guarding against this kind of disease?
I think from a public health perspective, it's good to be vigilant in the sense that we don't want to have additional cases or have an outbreak of monkeypox. But for most people in the community, monkeypox is not going to be like COVID-19. We do see some monkeypox around the country and in Europe spreading. It can spread via that droplet, but with this outbreak, we are seeing it mostly skin to skin for reasons not completely understood, a prevalence in men who have sex with men. And something we need to keep an eye on, but nothing that anyone needs to get too worried about at this point.
Okay, we appreciate your time and your insight, Dr. Pothof. Thanks for being here this afternoon.